we at Campaign of Campaigns, we've been following and supporting your campaign. And one thing that is integral to your campaign is the TRIPS waiver. So can you speak a bit about why the TRIPS waiver is so key in ending the pandemic?
Okay. Thank you for that question, Mumbi. So just to start, right? TRIPS stands for the Agreement of Trade-Related Aspects of Intellectual Property Rights, right? And the TRIPS waiver proposal is a proposal tabled by India and South Africa that would waive IP rules widely to make it easier for countries to start manufacturing, as I said, right, COVID-related health technologies, so equipment, tests, medicines, vaccines, without facing the legal risks of getting sued, you know. And the global, a very important fact is that the Global South has the capacity for it. A very recent Doctor Without Borders study reviewed that around the world we already have, the Global South has 100 possible sites that are ready to manufacture mRNA vaccines. Only if they had the vaccines and, well, sorry, the recipes and the technology for it, you know. So, and you know, I think it's important to go back a bit, but the idea of the TRIPS waiver is not something like out of this world. Countries are supposed to, during a health emergency, waive intellectual property rules so they can manufacture affordable medicines for their own population and even to supply to neighboring developing countries. Companies still receive royalties from it when you waive intellectual property rules and rights, but they don't profit enormously, but they still profit, you know, and they still earn money from it. It's not that obscene, those obscene profits that we are seeing on headlines, you know. But you shouldn't even be talking about profit, right? When it's a matter of life and death. But okay. And as I said, we have a huge and unpredictable challenge ahead. So it's just plainly unfair and actually a human rights violation that some countries can buy more resources because they have the money to do so, while others can't. Especially when we are living in a scarcity of resources. So these countries that have the money can secure their doses, while other countries can even, you know, there are countries that have 2% vaccination rates, and this is, you know, abhorrent. So, and 2 days ago, just to illustrate, Switzerland destroyed 600,000 doses, right, expired doses that they had bought, which, because the country bought 25 million doses more than the actual number of the population, you know. And so you see, we are treating a matter of life and a matter of health, and a matter of right at the end of the day, as a matter of market, you know, and to give everything to the highest bidder. And this is not how it should work. You know, things are inverted somehow.
Another thing that you talk about often is the colonial nature of the vaccine rollout. And when you think about vaccine accessibility, why is this an issue of colonialism and racism and capitalism and not just access to the vaccine? Why is it all these other compounding issues?
Thank you for your question, Mindy. So, well, a very illustrative case is that across the world, Black people, indigenous, and people of color have been less vaccinated, and this is a fact, not only across countries but within countries, you know. And this inequality is rooted in the legacies of colonialism. In Brazil, for example, where I am from and where I'm based, in April of 2021, in the beginning of the vaccination rollout, Black people represented only a third of vaccinated people, and Black people comprise more than half of Brazilians' population, you know. And while Brazil has a very high vaccination rate compared even to some European countries, because we do have a very good public system that, of course, has its flaws, we still have these vaccine deserts, and they're especially located in poorer regions, in indigenous communities, where health doesn't reach, the public health systems doesn't get there. So, and this is because also, even in more urban scenarios, people of color face different obstacles to access health services. So, and this is just, I was trying to give like an overview of more of a national perspective, but when we go to the international perspective, um, the same countries that are less vaccinated are the ones who have spent years being encroached of their resources by colonial systems, and the ones who have the highest vaccination rates are the ones who availed from it, So it is a matter of social justice, sharing technology, and promoting equitable access.
So why should feminists care? Why should we have a feminist approach to this? That would be my follow-up to that.
Yeah, that's a question that we love to answer. And that is, I guess, like the reason why the campaign exists. And we even just kind of a marketing pause. We even have an issue paper in our website that its title is "Why Should Feminists Care?" So we, Global South Feminists, we are the ones living and witnessing the worst effects of the pandemic in our countries, and the inequality between and within countries have only deepened with COVID. So among those people at the intersections of social markers such as sex, gender, race, class, sexual orientation, gender identity, ethnicity, migrant status, disabilities, and others are the ones most affected by COVID, So when a country, let's say the United Kingdom, who has been a very important piece in obstructing the adoption of the TRIPS waiver recently, stalls or undermines the negotiations at the WTO, this affects directly how, for just as an example, a person with disability in a least developed country will deal with the lack of a proper ventilation that is suited for their disability, and it deeply affects women. This is, I cannot stress enough. Informal workers around the world are mostly women, and their income was completely strained during the social distancing and lockdown measures. Care workers are also mainly women, and they've had their workload during the pandemic tripled. Trans and non-binary people have been denied access to services and to social aid because of distancing measures based on sex gender criteria, and this has happened in Latin America, for example. And these are just to name a few, right? And the rich countries' position at the WTO also makes countries with overflooded health service and stagnant economies borrow more money, become more indebted, and then they have to promote austerity measures and cut down on social expenditures, and this will affect especially women and will make women even more vulnerable. So vaccine equity and the negotiations at the WTO are an essentially feminist issue, and I think that's very important to say.
Thank you so much. Thank you so much for that. My final question. Earlier you mentioned targeting the WTO. My final question is, how will the WTO's decision in regards to the vaccine impact the world?
Well, I mean, if adopted, the TRIPS waiver would set a very promising legal precedent, a precedent that puts health in the logic of rights and not in the logic of market, as we've mentioned before. It could promote a very virtuous chain of development across the global south, because global south countries could be able to reach these technologies and recipes and produce it on their own. And this would tackle inequalities not only within countries, but between countries and across the world. It would ensure that we had all the resources necessary to fight the pandemic. So, of course, we would meet other challenges. You know, the TRIPS waiver doesn't mend everything, but at least IP wouldn't be one. You know, and countries wouldn't be in the risk of being sued by it. You know, and becoming even more indebted. And this has happened. You know, the history of the intellectual property framework shows that when countries do it, they end up getting sued. So I guess in a very optimistic perspective, it would be a sign if the TRIPS waiver was adopted in a meaningful way, right, in a meaningful language. It would be a sign of global solidarity and justice for once. It would mean that we don't want to repeat the same mistakes that we did during the HIV/AIDS pandemic, for example. It would mean that we are in this together for real, you know, not just in discourse. And I think beyond COVID, it would be a great example and even a precedent for to usher us into facing up to the challenge of the climate crisis in a solidarity and collaborative way, you know. And if the TRIPS waiver is not adopted in the terms that I said, right, in a meaningful language, with a meaningful language, and the proposal is submitted to the interest of global North countries, it sets then a very detrimental legal precedent. We would continue to live in these adverse and unpredictable times without any life-saving boats to hold on to. And this would require, I guess, when I was thinking about it, this would require a very strong national mobilization so that like national civil society organizations and governments would have to mobilize a lot across countries so they change national laws, you know. And but this would be a much more difficult and case by case scenario, which would be just overwhelming, you know. The TRIPS waiver has the capacity of being a global decision that affects the world in a very comprehensive way. And so it sets this international, very important precedent, legal precedent. So countries and civil society in countries can push them to waive intellectual property and manufacture for themselves. So we can't bear the brunt of not waiving intellectual property right now. You know, that's it, I guess.
Wow, that thank you so much. That is such important information to know. I think moving forward, we will definitely be supporting your campaign even more than we already do. So I will definitely share your website along with your handles, Dawn Feminist and TWN handles, when we share this live, because this was so informative. So thank you so much for joining us. Yeah, as I said, I will share your information. This is life-saving stuff. So thank you so much for everybody who tuned in today. Please look out for the live video. We'll have it posted on YouTube if you weren't able to catch the whole thing. So thank you so much. Thank you again, Rania. I really appreciate this. We were so happy to have you.
Thank you,
Thank
Mumbi.
you,
It's so great
Mumbi. It's
working
so
with
great
you.
working with you. All right. Enjoy the rest of the day. Bye, everybody.
Bye.